Arthritis is the pain, swelling, and stiffness in your joints. The term arthritis is used to describe about 200 conditions that affect the joints, the tissues surrounding the joints, and other connective tissues. It usually affects adults over the age of 65, but it can affect people of all ages, even children and adolescents. Arthritis is more common in women than men and in people who are overweight. The symptoms of arthritis usually develop over time, but they may also appear suddenly. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Symptoms of arthritis. The most common signs and symptoms of arthritis involve the joints. The symptoms may include pain, swelling, stiffness, and redness. People with arthritis may experience decreased range of motion, and their symptoms may worsen in the morning. If you experience joint pains that do not go away after a few days, see a doctor. Finding out what's causing your pain is the key to finding the right treatment and self-help options. Although there is no cure for arthritis, treatment has improved significantly in recent years, and there is a clear advantage to starting treatment at an early stage for many types of arthritis, especially rheumatoid arthritis. Causes of arthritis. Osteoarthritis and rheumatoid arthritis affects joints differently. Osteoarthritis involves wear and tear damage to the joint's cartilage. This increases friction between the end of bones in the joints and can cause bone grinding directly on bone, resulting in pain and restricted movement. Such a deterioration can occur over many years, or it can be aggravated by a joint injury or infection. In osteoarthritis, the entire joint is affected as it causes changes in the bones. The connective tissues that hold the joint together also get deteriorated. Inflammation of the joint lining is also seen. Rheumatoid arthritis is an autoimmune disorder. The body's immune system attacks the tissues of the body. As a result of these attacks, the synovial membrane that produces a fluid to nourish the cartilage and lubricate the joints becomes inflamed and swollen. Rheumatoid arthritis can eventually destroy cartilage and bone within the joint. Risk factors of arthritis. It may be difficult to determine what has caused your arthritis. There are several factors that can increase the risk of each type of arthritis. Some types of arthritis run in families, so you may be more likely to develop arthritis if your parents or siblings have the disorder. Your genes can make you more susceptible to environmental factors that may trigger arthritis. Age is also a factor. The risk of developing most types of arthritis increases with age. Most types of arthritis are more common in women. However, gout is more common in men. Previous injuries and damage to a joint can contribute to the development of osteoarthritis in that joint. People who have injured a joint, perhaps while playing a sport, are more likely to eventually develop arthritis in that joint. Being overweight can contribute to both the onset and progression of knee osteoarthritis. Carrying excess weight puts stress on joints, particularly your knees, hips, and spine. Certain occupations that require frequent knee bending and squatting can also result in osteoarthritis of the knee. How is arthritis diagnosed? Muscle and joint pain occurs from time to time. This is especially true if you do unusual or strenuous exercise. So, how do you differentiate between the first signs of arthritis and your usual pain and stiffness? How do you know when to see a doctor? If you have unexplained swelling or stiffness that doesn't go away after a few days, or if it hurts to touch your joints, see a doctor. Early diagnosis and proper treatment can lead to better results. Doctors often use imaging techniques such as X-rays, MRIs, and CT scans to get images of your bones and cartilage. This will help to rule out other causes of your symptoms, such as bone spurs. What are the treatment options of arthritis? The goal of treatment is to reduce the amount of pain you feel and prevent additional joint damage. You will learn what works best for you in terms of pain control. Some people believe that heating pads and ice packs have a calming effect. Others use crutches and walkers for support to avoid putting more strain on the sore joints. It is also important to improve your joint mobility. For best results, your doctor may prescribe a combination of treatments. Arthritis treatment generally includes rest, occupational and physical therapy, exercise, medication, and joint repair surgery. Osteoarthritis treatment generally helps relieve pain and stiffness, but the disease may continue to progress. While the same was true for rheumatoid arthritis in the past, new treatments for rheumatoid arthritis have been able to slow or stop the progression of joint damage. Your doctor may prescribe non-steroidal anti-inflammatory drugs to reduce the pain and inflammation of rheumatoid arthritis and osteoarthritis. Your doctor may recommend an injection to relieve pain and stiffness in the affected joint. Depending on the person, the results can range from temporary relief to long-term relief of symptoms. Various forms of surgery may be needed to reduce the discomfort of arthritis or to restore movement and mobility of the joint. If the joint pain and inflammation is really unbearable, or if the joint is severely damaged, the best option may be surgical replacement. There is no cure for arthritis, but proper treatment can drastically reduce your symptoms. In addition to the treatment recommended by your doctor, you can make several lifestyle changes to help manage arthritis. Remember, the more you are able to stay physically and socially active, the more control you will have over your life and the less control arthritis will have over you.